At MiraCosta, we offer a wide range of programs from medical assistants all the way up to ADN nurses. So we have our LVN students, CNA students, medical assistant students, and our associate degree nursing students. We have a great simulation center where students in all semesters of school get to participate in different simulations. We have a great nursing lab where we have instructors where students can go and practice, and then all of our theory classes are accompanied by clinical placements.
I was a City of San Diego lifeguard and EMT for 12 years. What was always tough for me was, seeing those patients leave in the ambulance and not knowing their outcomes. So rather than being on the giving side of care, I wanted to be on the receiving side of care and provide a higher level of hospital care for those patients. You start with your lab clinical days, and that lasts for roughly 8 weeks, but you're tested each and every week on a different skill. And if you miss one portion of that skill, you have to remediate the following week. So you need to come prepared and know your stuff. And they take it very seriously, but the instructors here are well versed in the nursing profession, and they lead us towards success.
The equipment here at MiraCosta is actually really great. They have full-on setups that look real. I mean, our models are mannequins, but we actually sometimes practice on each other, which is nice too, so we get real human interaction. But they have monitors that are showing the vitals on the screen. We can really apply the oxygen, and the oxygen machine works, and so they make it as real as possible. And when you get into the hospital, you're like, oh, okay, I've seen this before. So they do a pretty good job of making it pretty real.
MiraCosta's nursing program is ranked number 5 in the state of California for ADN programs. We're also nationally recognized for our NCLEX passing rates and also graduation scores. I've chose to work at MiraCosta as an instructor not only because I was an alumni, but I know that it has very top-level professors and instructors getting those students ready for the profession. The hands-on experience that we have for our students in the clinical setting, both in the hospital and nursing facilities, enables them to be not only safe, but also very skilled providers once they leave our program. They also spend in their RN program 4 semesters, bedside and clinical, really honing in those skills.
For the specific skills are how to take vital signs, do head-to-toe assessments, how to administer injections, to medication administration. So it is like everything that you need to know. It's absolutely important that we train today's nurses because, as the population increases and we have things going on like the COVID virus infecting not just our local community, but globally, it's imperative that we train us to be ready to respond to everything and anything.
I think nursing, out of most careers, what you learn in school, what you learn in lab, and what you learn in your textbooks and your professors are enforcing, absolutely transfers over to the hospital and the clinical setting. My personal goal is what's called a CRNA, Certified Registered Nurse Anesthetist. That's my goal. It's a long-term goal. You can do everything from school nursing to critical care nursing in the ICU, PACU, pediatrics, geriatrics, hospice care. There's really so many different paths. So nursing's so vast that it's if you don't love one area, there's other areas. So it's you have a lot of choices.
We are able to have clinicals at various hospitals around San Diego County, as well as ambulatory care settings. So our students, they really are prepared when they graduate from our program to assume any type of nursing position within the community.
Today's nurses are faced with a lot of different things bedside, not only COVID, but it's becoming an even more demanding profession with us expanding into telemedicine, working in urgent cares, reaching those patients at home for consults, and healthcare really has job protection and job security, as we saw through this pandemic, probably better than any career out there.
The best piece of advice I have for a prospective student would be just make it happen. If it's something that you want to do and something that you've prepared to do, and you've taken the TEAS exam, you've taken your prereqs, and you think that this is something you want to do, don't hold back, immerse yourself in it, and dive head first.